Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room with Dr. Donica. Today, I am joined by our fabulous guest, Carri Levy, who is the creator of Behind the Mystery, Rare and Genetic. This is a national television series devoted to rare and genetic disease awareness, which airs on Lifetime Television's morning show, The Balancing Act. So this is a part of The Balancing Act. Carri started her career in television as a producer for Designing Success in 2006 and transitioned to producing the Balancing Act's Choose Health series in 2011. A year and a half into that role, she took a hiatus to care for her daughter, Ilana, whose health was deteriorating due to a rare and undiagnosed disease. And we're going to hear a lot about that. It was during this time that Carri made it her mission, just like most mothers do, to find out everything she could, not only about her daughter's condition, but about rare diseases in general. And a quick Google search led her to the National Organization for Rare Disorders, where she learned that there were over 7,000 rare diseases affecting up to 1 in 10 Americans. So we all know somebody who's been affected by a rare disease, and over 350 million people globally. So it was this discovery that inspired Carri to leverage her role as a national television producer to bring awareness of rare diseases to a mainstream audience. So here we are now, 8 years later. Carri and her team have produced over 85 disease-specific segments within their Behind the Mystery Rare and Genetic season, which is incredible. Carri, welcome to the ladies' room, and tell us how this all began.
Oh, thank you so much for having me. It began because my daughter was really, really sick.
Mm-hmm.
And
at what age?
She was born sick. She was always sick. And I was always being told by doctors that there's nothing wrong with her. We don't know what's wrong with her. It's just constant being tossed out of doctor's offices.
And what symptoms did she have? And was she your first child?
No, she was my baby.
Okay. And you had how many children before that?
I have another daughter that's 15 months older than her. Okay. Who was it was the perfect child. I always said if Ilana was born first, she would be the only child because she was so difficult.
There's a saying actually that if your second child was born first, you would never have a second child.
Yeah.
But so you knew what a healthy baby looked like and acted like and was supposed to do and the milestones and all of that. Yes. So what were her symptoms, her primary symptoms?
She was, from day one, she just screamed and cried. Colicky for the first 7 months, could not put her down. She didn't tolerate formula, breast milk. She didn't tolerate formula. She just always had a problem with her stomach. I remember going to a doctor when she was 3, like a GI specialist, and because she couldn't even go to the bathroom unless she was like totally unconscious. So training her was really, really hard. And he would always say to her, poop a day keeps the doctor away. That was his saying. We still use it today. And
did you ever have that book, Everyone Poops?
Yes.
That was like my favorite book of all time.
Yes. It was
I highly recommend it to everybody who's going through potty training right now.
Yeah, excellent book. So she always had problems with her stomach. And what we didn't know was that as she was growing up, that she was actually forming adhesions internally that actually, when we finally had an emergency surgery done on her, they found when they opened her up that she had adhesions that were wrapped up around all of her organs and had pulled them all into a knot on one side. But you couldn't see that through a colonoscopy or an endoscopy or any kind of...
So just for people who are listening in who don't know, adhesions are basically scar tissue.
Right.
And this usually forms in people after they've had surgeries.
Right.
It doesn't usually form for no reason at all. So what did they tell you the reason was for the formation of the...
They had no idea, spontaneous. And she's had subsequent surgeries after that too. And anytime she gets any kind of, like she had a port, she had 2 ports. And the first time she had sepsis.
And the reason she had a port was because
she couldn't hydrate enough. She has, we found out she has a condition called dysautonomia.
Okay.
and POTS, which is postural orthostatic tachycardia syndrome, which is not rare, but it's very hard to diagnose. But she couldn't hydrate enough, and so she needed a port to get hydrated, saline a couple of times a day, and it became infected. She got sepsis. It was horrible. They took a scoop out of her. But even to this day, as you look at her, the scar tissue, the scar that's across here, just will burst open out of nowhere as you're talking to her, and just burst open and start growing. So it's
okay. And so that's the scar that's on her chest, because most people are listening to us on a podcast, so they can't see what we're actually doing.
It's a scar on her chest, but even internally, she's had a couple of surgeries just because she gets, adhesions inside of her. In fact, she just called me before we got on the phone that she's in terrible pain, and so we're just deciding on what to do, this weekend about, should we go to the hospital now, or, what's the next step here?
And she's how old now?
Now she's 30.
Okay.
So she's not a baby.
I assume she's been evaluated at the National Institutes of Health?
No, she has not. We've applied. She's not, because of the dysautonomia, she's not a good traveler at this point. Part of the symptoms of dysautonomia are like 24/7 nausea. And so it's a mess, but she is the author of a book called Surviving and Thriving with an Invisible Chronic Illness.
And she is certainly thriving. I looked at her website, which is ilanajacqueline.com. We'll give her a plug.
Yeah.
This woman is a dynamo.
She is amazing. Thank you.
So not only has she become an author, but she has also become a fierce and dedicated advocate for people with rare diseases. And the ways in which she has approached this are incredible. So just give us like the top bullet point highlights of all of her achievements and activities. She's
just an incredible advocate. She's an author. She's able to help people with humor. And I think that's where she really excels, because she looks at life and everything that goes on around her with such an eye for laughter. And that's, and she's married, and she's the mother of a little puppy named Happy. And she's right now trying to have a baby. So that should be interesting. So that's a journey that we're going down the road with. And she's just an incredible woman. I'm so proud to be her mom. So.
Well, you should be. And of course, you obviously set an incredible example for her from a very young age. And I really want people to think about this as we have the rest of this conversation. What really struck me was the number 1 in 10 Americans have some form of rare disease. And that means we all know somebody who has a rare disease, maybe not in our families, but probably in our families. We may not know the name of the disease, and we may not know that it's specifically called a rare disease. And of course, tell everybody what the definition of a rare disease is.
A definition is under 200,000 people that are diagnosed with a disease.
In the United States.
In the United States, yeah.
So the good news about rare diseases, and I really want to drive this home, because as you know, and everybody knows, I never give up about vaccines. So the good news is that many diseases have become rare because of vaccines. So diseases that used to be common, like polio, measles, rubella, tetanus, hepatitis A, diphtheria. Most doctors have never seen a case of diphtheria in the United States because of vaccines. Pertussis, which is also called whooping cough, mumps. Now, a lot of these diseases are making a little bit of a comeback because people are not being diligent about vaccines. So those are all infectious diseases. Most rare diseases, of course, are genetic, and many are cancers. So the other thing I want people to know is that 100% of pediatric cancers are rare diseases. But I really want people to just take a moment and think about all the people they know in their own lives who have rare diseases. And I want to give a shout out to some of our previous podcast guests. I'm actually wearing burgundy today because in the ladies' room, we're big supporters of the Global Liver Institute, and the founder of the Global Liver Institute, Donna Cryer, has been a guest.
Wonderful lady.
She's incredible. Yeah. She's absolutely incredible. And she will kill me if I don't remind everybody that next week on February 29th is National Rare Diseases Day. So I want everybody to really focus on all of the information from NORD, which is the National Organization
of rare diseases, as well as Global Liver Institute, which is globalliver.org. And we've had a couple of other guests who coincidentally have also had rare liver diseases in their family.
Oh.
So one was Dr. Dara Cass. I don't know if you know her. She's an amazing emergency room physician in New York. And her son was born with alpha-1 antitrypsin.
We've done a segment on it.
Yeah, so that is an incredible, and that is one of the most common causes of liver transplant in children.
Yeah.
And then we also, have you done a segment on primary biliary cholangitis or PBC?
Am I doing one on this year? I think it sounds like I've either doing one or I've spoken to them about it.
Yeah,
so
that would be a great topic. We had two fabulous women, a mother-daughter pair. The daughter is a world-renowned photographer who does not have PBC yet. Her name is Emily Blinko, but she's at greatly increased risk because her mother has PBC. So they did a campaign called Live Her.
Oh, wow.
Liveher. Great couple. So listen to that podcast. And then we've probably done lots of podcasts where people have mentioned it, but I want to give a shout out to one of our future podcast guests who's also from Florida, who's very involved with the Fragile X Society. Have you done, or Families for Fragile X?
We're going to be doing Fragile X this year on talking with that and CBD, I believe.
Okay, well, let me introduce you to her. They're fabulous. They have a huge 5K run walk every year in Miami. But Fragile X syndrome, for those people who don't know, is the leading known cause, diagnosable cause of autism. And it's also the leading diagnosable cause of intellectual disability in the United States. And it has a whole host of associated problems and disorders, and that is genetic.
Yeah.
So tell us about your favorite episode, aside from, I'm sure Ilana has been on at least, I saw one episode that she was on.
Yeah, she's been on it 3 times already.
Oh, wow.
She comes on for Rare Disease Day just to give us an update on where she is and what's going on in the world of rare. So this year we're doing a whole digital piece, a series, so it'll be a little bit different than what we usually do on TV. But my favorite,
some of your other favorite episodes.
Yeah, I think my favorite episodes have been like at the beginning, like Pulmonary Fibrosis Foundation, I think was one of my favorites, because when I first started the series, I was walking through DSW on my lunch hour, and I saw this woman who was my age that was carrying like a whole thing of oxygen with her, and I was, I'm a New York Jew, so I walked up to her and I said, "So what's going on with you?" And she said to me, "I have pulmonary fibrosis, and it's a disease that attacks my lungs, and I'm end stage, and I have to have oxygen with me." And so she told me all about it, and she told me about the Pulmonary Fibrosis Foundation, and she told me about different companies that were working on it. And so I went right back to the office. I called up the Pulmonary Fibrosis Foundation, spoke with them, and they were wonderful. So they came on the show and they did a really good segment to raise awareness about the disease. And the lady that was on the show, her husband worked with Howard Stern, and he had a lung transplant. He's doing great. But they every year for pulmonary fibrosis, I always like put it up on the website and create awareness about that. And then from there, I work with another organization that was in that same genre. But I think that the ones that touched me are just seeing, like, the daughters and the moms and their they're just the families, how they all pull together, and there's so many of them that we work with.
And certainly anybody who has anyone they love who has any kind of illness knows that illness does not just affect the patient. Illness is a family affair, and it takes a village, and it takes a whole team of healthcare workers and community workers. And it really takes all of us to kind of look out for people that we see in a DSW shoe store. And so we can say, "Can I help you with that?" Or, you don't have to ask them what's wrong with them, unless you want to be particularly chatty. But what's interesting, I was thinking about this too. And I had a friend from college who fortunately successfully had a double lung transplant.
Oh, awesome.
Because of a similar condition. So that was great. But I had another friend from college, and I don't think of myself as that old. I guess now I 50 is looking younger and younger to me every day. But I have another friend who unfortunately died of one of the most famous rare diseases, one of the rarest yet most famous, which is ALS.
I knew you were going to say that, yeah.
Amyotrophic lateral sclerosis, which is extremely rare.
Yeah.
And most people have heard of ALS because of the Ice Bucket Challenge, which was one of the most brilliant PR campaigns for any disease I have ever heard of. But they don't realize that there's about 5,000 people diagnosed per year and about 16,000 people living with this disease.
Or what it does to your body, or what it's like, with the whole living with ALS.
Mm-hmm.
I actually did a segment on Behind the Mystery on it just because of that, because of the Ice Bucket Challenge. People, they knew the word, but they didn't really understand what it meant and how it's very horrifying just to know that you have that disease and for your families. So I wanted to really put a face to that and to have people understand what's really happening here. So that's why we did this.
And most people don't realize that ALS is the same as what we used to call Lou Gehrig's disease.
Right.
For the most famous, person who ever had ALS. But what's also interesting when I think about ALS, I've kind of done an informal survey with friends of mine who are physicians, but I wish some PR company would actually pay to do a survey of, 1,000 or 5,000 physicians and ask us what our 3 most feared diseases are. And I think it would surprise people. So most of my friends, like me, I would say my number 1 most feared disease is Alzheimer's disease, because most physicians fear losing our minds. But I think the next fear would be ALS, because you don't lose your mind, but you lose all of your bodily functions. And then for me, third is probably a tie between pancreatic cancer and ovarian cancer, because both of those are pretty deadly and we don't have, very good screening techniques for them.
Or Huntington's disease, I think would be also as well. My son-in-law has a very rare form of pancreatic cancer. My older daughter, who's 31, her husband got diagnosed at 20, I think it was 25. Crazy. We were my daughter and I were on a mother-daughter vacation, and we were driving from Portland to throughout Oregon, and she got a call from him that he found a mass on the left side of his abdomen, and I immediately knew what it was. But it was the rarest form. It's called acinar cell carcinoma of the pancreas, and it's so important, I think, when just being a producer and understanding what the trajectory of diseases are, that you get support. And the PanCam, the Pancreatic Cancer Association, they were phenomenal. If you ever get diagnosed with pancreatic cancer, call PanCam. Get as much information as you can from them. They will tell you where the clinical trials are. They'll let you know where to go, where the tertiary centers are. I just think with any disease that you have, if there's a foundation, an organization that represents them, reach out to them, because they really are cutting edge. They really know what's going on in those diseases.
And what's great is that most diseases do have some kind of foundation or patient support. But with rare diseases, I was really surprised, even as a physician, to find out how many rare diseases are actually covered, by the National Organization for Rare Diseases. It's over 7,000. And then the other really, disheartening statistic is that over 90% of rare diseases have 0 FDA-approved therapies. And you can understand why. It's very difficult to do research on a disease that has such few patients. I actually lost a close friend of mine several years ago, who I still miss. She had cancer of the appendix. And as a doctor, I thought she got it wrong. Because I had never heard of cancer of the appendix. And I looked it up, and that year, there were only 13 cases in the whole entire country of cancer of the appendix. So, unfortunately, all of these diseases have to be represented by one group, which is, the National Organization of Rare Diseases. And they do have a wonderful online glossary that I like, that you could look up.
It's amazing.
Any disease.
Yeah. It's amazing. And Global Genes also. Global Genes is another foundation that we've worked with that is an overarching foundation, and they help the smaller foundations learn how to build their foundation. And they do a phenomenal job as well. So the two of them are real, they're just pillars of the rare disease community.
So with respect to your daughter having had POTS, or postural orthostatic tachycardia syndrome, which is more common in girls,
Yeah.
it is also not uncommonly associated with other diseases and disorders, as in her condition. It is very often in children associated with chronic fatigue syndrome. So that's lumped together. But do they have their own organization or society?
Yeah, the Dysautonomia International is a woman named Lauren Stiles runs it, and she's incredible. She's built a really good organization. She does a lot of research. I think there's so many people that are getting diagnosed with it, and I think the problem with dysautonomia and POTS is that because these girls are so young, and it's men also, it's boys also, but because they're so young, and because when you have tachycardia or when you stand up and you get postural tachycardia.
Yeah, tachycardia is just a very rapid heart rate. So
Yeah.
what happens in these patients, just for people who don't understand, is that when they stand up, they can become very lightheaded or dizzy or nauseated.
Pass out. Yeah.
Faint, and have multiple, different complications as a result.
Yeah. So when a lot of the children that have it, they're being told that they have anxiety, and that's what they told my daughter for years. Oh, it's psychological. And I came to a point where the principal of the school said, you need to take her out of school and get her a diagnosis, and then you can bring her back. And she ended up being homeschooled because we couldn't get a diagnosis. I mean, it was a very long road, and the only way to really diagnose is a tilt table test.
Right.
And that was not many doctors would give you that at the
Well,
time
first of all, not many doctors have a tilt table.
Yeah.
Not many doctors know about it. So what we do is what we call a poor man's tilt table test, which is where you just take your blood pressure lying flat, take your blood pressure sitting up, take your blood pressure standing up. And my son actually was evaluated for this. I've spoken publicly about this. My son had very severe chronic fatigue syndrome for many years.
Sorry.
So he was actually evaluated for POTS. And what happened with him, he had a very mild form. So his blood pressure held until when he was standing up, they said, okay, now close your eyes and stand there for 60 seconds. And he couldn't do it, even though he was an athlete.
Yeah.
So as soon as he closed his eyes, he started to fall. So that was pretty illuminating. But we went through the same thing where since he was a boy, they didn't say he had anxiety. They said he had depression.
Oh, nice.
So this brings up an extremely important point, and that is how incredibly important it is, especially for children who are ill, to have strong advocates, who like a parent or, a doctor in the family who can say, this is not how he was the day before he got sick.
Yeah.
And depression doesn't generally come on, or anxiety doesn't generally come on in one day. And you need people who can vouch for you. So even his own pediatrician, who became quickly his former pediatrician, said to me she thought this was school avoidance behavior.
Yes.
And my son had a track record until, the day he got sick, that he not only loved school, he had this competition going with the teachers where he wanted to be the first one there because he had the responsibility of turning on the lights. And that was his favorite job to do, was to be the first one there at school.
Yeah.
So, you really need to have stories like that sometimes to impress upon physicians about how it's real. And the problem with a lot of these conditions is there's no blood test or x-ray or biopsy that can prove what the condition is. I'm assuming that when your daughter had her surgery for her adhesions, they did biopsies of the adhesions.
It's interesting because the doctor that did it was actually the gynecologist that treated me. And I went into him after she was just, she would come out of like a colonoscopy or an endoscopy, and the doctors would say, you're fine. And she would start screaming, I'm not fine, I'm not fine, I'm not fine. And as she was eating, she stopped eating. All she would eat was like a piece of white bread, like balled up, and some water. And it was like glass going through her. So I didn't know what to do. So I called the gynecologist who had operated on me many times for endometriosis, and my sister for endometriosis. And I said, look, I said, can you help me, please? I said, this is what's going on. Can you please do an exploratory on her? And he did. And when he came out a couple hours later, he said, I've never seen anything like this. It's not endometriosis. This is like crazy stuff. And he said, and I couldn't get it all. He said, you can have to go to a colorectal surgeon. Nobody would operate her on her afterwards, except a year later, she got so bad again that we got an oncologist, gynecologist to go in who was like really proficient in that. And at the second time, she had an appendicitis that we didn't even know that had been wrapped with adhesions to hold it in place, so that that's how much pain this child was in, that we didn't even know she had an appendicitis because she was in that pain daily.
Oh,
so
thank God it didn't rupture. Because of course, people who have a ruptured appendix also are much more, they could die, of course, but they also are much more likely to get adhesions. There was actually, I hate to admit what a big fan I am of Grey's Anatomy, not because it's medically accurate all the time, but because it's fun and interesting and my guilty pleasure. But they actually did an episode on a patient, a young woman, she was probably 20, who had a very similar situation. And she only had extreme pain after she would eat anything. So it was the same thing. She could only eat like a little teeny tiny piece of bread or something without having terrible pain. And what they discovered is she had adhesions, but that were moving. So only when she was digesting, then the adhesions would wrap around her intestine and cause, an intestinal blockage when she ate anything.
Yeah.
Now, of course, on Grey's Anatomy, the patient shows up, they get diagnosed, treated, discharged,
in an hour,
and fall in love in one episode.
You know what show that I used to love was Royal Pains. I don't know if you ever saw that.
I never watched that.
Oh my God. Every rare disease that I've ever heard of was because of that show. It was the best way to educate people on rare diseases.
Well, I defend my guilty pleasures of watching television very often by pointing out that there were 3 questions on my national boards, my national medical boards, that I got right only because I had seen episodes about those conditions on television. I never would have watched it. And one of the questions that I got right was the weirdest question. And the only reason this question could have been on the boards was to see if you had watched that particular episode of MASH, because it was on the idiosyncratic effects of amphetamines on laboratory animals. It was just such a random question. And you would think, if you were just, you would think the effects of amphetamines are that they make everything speed up. But because Radar had a pet rat who was given amphetamines because he was in a race with a marine pet rat, I learned that what happens when you give rats amphetamines is they just run around in circles.
Oh, wow.
And thanks to MASH, I got that question right. I don't know how I got all the other questions right that I got right, but I know that's how I got that. Anyway, so tell us, sneak preview, what's coming up in future episodes.
Oh my gosh, we have, this year, I think we have like 16 already that are in production. So we're doing, I wrote it down because it's Wilson's disease, urea cycle disorder, Alport syndrome, Friedreich's ataxia, Castleman's disease, FOP, giant cell arteritis, arginase deficiency, spinal muscular atrophy, myasthenia gravis, which I'm excited about, glioblastoma, which I've been trying to do for years, and we're finally, it's a hard disease to do when we're in pre-production, but we're doing it. Acromegaly, IgA nephrology, and there was one more.
So the good news about acromegaly, which lots of people believe Abraham Lincoln had,
Tony Robbins.
Tony Robbins, is that official or is that just a supposition? I don't know.
I believe he said he did.
Okay. So the good news about acromegaly is there are treatments,
at
least for acromegaly. And I used to do acromegaly research on pituitary tumors.
Oh, wow.
So, that's good about that, but that's quite a lineup. And I don't know if you know this, but I used to do a lot of television. I was the women's health correspondent and contributor for the Weekend Today Show and the Later Today Show. And they would never let me cover diseases that were rare diseases.
Why?
Because they said it wouldn't be of interest to a broad enough audience.
Wrong.
Right. Now, this was in the 1990s. So the good news is we've come a long way, baby. But even as a podcast host, I have to tell you, Sometimes when I do some of these conditions like primary biliary, cholangitis, I have to say, is there going to be enough of a general audience interest? So the nice thing about doing an episode for Rare Diseases Day is we're covering 7,000 diseases
Right.
that affect over 350 million Americans altogether. So there's something here for everybody. What do you want people to know, aside from how to tune into your show? What do you want people to know about rare diseases in general? We've already talked about how important it is to have an advocate. That's number one.
Yeah.
Number two, you've talked about how important it is to find the related support organization, which you can find at Google, my personal friend. So what's the next most important thing for people to know?
I think, when I said to find an advocate for you, or to have an advocate for you, like I'm an advocate for my daughter, but more importantly, I taught her how to be an advocate for herself. And I think
important.
Yeah, and I think that is the most important thing, because even at my age, like I get so worn out going to doctors. Like when, for instance, I fractured a vertebrae in my back
Nice.
a couple of months ago, and I don't have the energy or the time to deal with doctors and insurance and to even take care of myself. And I think I'm the worst example of an advocate for yourself. But if you're really, really sick, and you're really, really sick and life-threatening, and your life is just is going down because of what's going on with you, don't give up. Really, don't give up, because you can find out what's wrong with you. The show that I do is a great show. We're giving really concrete, linear information so people can watch it and understand. But go to NORD, go to Global Genes, find as much information as you can. And that's how you advocate for yourself, is to get all that information and to find the right place to go. Because I think the hardest thing is finding the right doctor who's going to diagnose you and help you. And that's my nope.
I think the most important thing you just pointed out is that you can learn to be an advocate for yourself or for other people. So let's talk about very specific tips for advocating for yourself. So one of the tips I always give people, for example, is make a list of your questions before you go in. And if you have a chronic condition, the list doesn't have to be made the day before your appointment or the 5 minutes before your appointment.
Right.
You can keep, we all have cell phones now, or most of us do. You can keep a running list on your phone as you think of the question and write it down. And I do this as a physician because I know I'm not going to remember all the questions that I had.
But as a physician, I've been told by physicians, do not bring me more than 3 symptoms at a time, because I can't handle that. And I think that's a hard thing when you have something like my daughter, who has so many crazy off the wall things that are happening from one month to another. So to walk in and to just say, these are the 3 main things that are happening to me. But that's what doctors are telling me that they want to hear. They want to know the 3 main things. And I think
so we definitely want to hear the 3 main things in terms of a priority. But many diseases have, especially autoimmune diseases, have lots of crazy symptoms. Talk to anybody who's ever had Lyme disease. I think there's over 150 symptoms of Lyme disease.
Right. Graves' disease.
Graves'
disease is another one.
We've talked to Gail Devers, who was an Olympic champion who had Graves' disease. And very interestingly, President George H.W. Bush and Barbara Bush both had Graves' disease.
Oh, interesting.
Leading one to wonder whether there's some kind of environmental trigger there, because we still don't really know what causes many autoimmune diseases, including Graves' disease. But I think if you find or encounter any physician who's not willing to listen to—
walk away.
Yeah, that's a clue that you didn't find the right person.
Yeah.
The right person will say, tell me what the 3 worst symptoms are. But they won't say, I don't want to hear about everything else. Now, if you have 13 different diagnoses, they may say, okay, at this appointment, this is called agenda setting. They say, at this appointment, what is the most important thing you want to focus on?
Right.
And maybe we can get to number 2 and number 3 also, but we have to make another appointment for number 4, 5, and 6. That doesn't mean they're not equally important. And of course, for people who unfortunately have many conditions or more than one thing, they very often have to see more than one type of doctor.
Yeah.
So that's also frustrating. But I think what we have to figure out is who is the right doctor. Thank goodness you were able to find a gynecologic oncologist for your daughter. Most people don't even know what this kind of doctor is. This is a gynecologist who goes on to get further fellowship training for 3 additional years and board certification in oncology or cancer treatment as well. And they focus generally on cancers of the reproductive tract. But most people don't realize that gynecologists have a tremendous amount of experience surgically with adhesions, because anything in the pelvis, ovarian cysts, ovarian surgeries, uterine surgeries, endometriosis, all
C-sections,
C-sections can all cause adhesions. And so gynecologists have always been at the forefront of even research into how can we better alter our surgical techniques and post-operative care to reduce the formation of adhesions.
Yeah.
But back to the thing about your daughter and the adhesions, I'm surprised they didn't send that for a biopsy.
We, it's been years, so we actually, looked back, and here's another tip, which is a big tip. If you're going to get a test result for any kind of test, take that test result. Don't just take it from what your doctor says, but look at that test result, and you need to Google everything that test result says, because if you're not looking at that really, really clearly and understanding what that test result says, your doctor is not looking for the same thing that maybe down the line as you're still being sick, or as you're finding new things that are coming on. Like the other day, my daughter went to the doctor, to a new neurologist, and the neurologist, they're having a great conversation. She's there an hour and a half. At the end, she goes to examine her, and my daughter has migraines. That's one of her symptoms, which is part of dysautonomia. But when she looked in her eyes, she said, your eye is very cloudy, and I think you have a spinal fluid issue going on here. I want you to go right to your eye doctor, and then I need you to get an MRI, and we might possibly need to do a spinal tap. With dysautonomia, one of the associated diseases is Ehlers-Danlos, which is, which we were told by a geneticist she doesn't have it because there's only a couple. She doesn't have, she's not able to do like this,
right,
to touch her thumb.
So people with Ehlers, we actually do have an upcoming guest who's going to be an Olympic champion who's going to be talking about her experience with Ehlers-Danlos syndrome. Ehlers-Danlos syndrome, for people who don't know, is a connective tissue disorder. And that is what I was thinking of when I said I was surprised they didn't biopsy the actual adhesions.
Yeah, but she's had biopsies on different adhesions since then. But
the movements you were doing were indications, for people who are just listening and can't see what you were doing,
right,
indications, they're tests of extreme flexibility, which is often associated with Ehlers-Danlos syndrome. And speaking of rare diseases, I very clearly remember when I was learning about this in medical school, and the professor, this was his research interest, he gave a whole lecture on it, and we all were testing ourselves in the room. And then at the very end, he said, and you might see one patient with this in your entire career.
But I keep meeting people that have it. I had an interview yesterday, and the woman that I spoke to was talking about what was going on with her. And I said, Molly Major is my partner who created the series with me. We both said when we got off the phone, she's got Ehlers-Danlos. So it's more and more people. I don't even think it's rare anymore. I think more people have it than you could possibly imagine, but there's so many diagnostic indicators for it. So anyway, she came home, she went through her records, found an MRI from last year, which she really had not really looked at as the results. And it said in her MRI on her brain that she had like a Chiari malformation. Chiari malformation. Yeah, Chiari malformation, which is indicative of people with Ehlers-Danlos as well. So
you can also have that without having Ehlers-Danlos. And just so you know, a Chiari malformation can cause horrible headaches that mimic migraines.
Yeah.
And it's often diagnosed in young people. But I actually met a woman at the nail salon, of all places, who was a marathon runner who had no symptoms at all except what she thought were migraines. And at the end of the marathon, she fainted. And of course, everybody assumed it was from the fact that she just ran a marathon.
Right.
But, in an abundance of caution, they brought her to the hospital and they did an MRI of her head because she hit her head when she fell, which is why they did the MRI. But that's how they found the Chiari malformation, and she had to have brain surgery. So, these things are, I think one of the reasons also that a lot of these things are are being diagnosed much more frequently now, certainly than 20 years ago or before, is thanks to the internet and spreading information and podcasts and television shows. But also because we have much better diagnostic
MRIs, for sure.
techniques and technologies. And we have much greater awareness thanks to organizations, like NORD. We did do a previous episode with Dorothy, the organizer, Dorothy Brenninger from the hit television show, The Hoarders. And she was the full-time caregiver for her sister who had terminal breast cancer. And she developed a kit, an organizer that she's giving to people for free if they go to her website and request it, to help you organize your medical records.
Perfect.
Which, of course, we all also is another great tip, is keep your medical records.
My daughter has a binder, and whenever she walks into a new doctor's office, she brings that binder, and it's got all of her test results. It's got everything, and a write-up and a description of her diseases, so that her doctors will understand what these diseases are, and the background and the science behind the diagnosis of these diseases, so that they can't say it's all in your head or I don't believe that. Because I still hear that. I still hear that from people that call me, that connect with me on LinkedIn and Facebook, that they're still getting kicked out of doctors' offices or saying it's all in your head, or Munchausen by proxy. I mean, just open up a book, do some research, doctors. Come on. It makes me nuts to hear people being kicked out of doctors' offices and made to feel so much shame about being sick. And that's another thing that I would say. Forget about this shame, because it's bull. You don't have to feel shame because you're sick. And I'm sure you've gone through that with your son. Like, what did I do wrong? What am I not doing?
And I will tell you, I didn't, because, and that's one advantage of being a physician and having been his mother and knowing that he was, such a diligent student before he got sick, and that he was such a determined athlete before he got sick. And I saw the dramatic change, and I was his advocate. But I did say to one doctor, I finally got to this fabulous expert who was terrific. And I said to him, just conversationally, what happens to kids who were not into school, or who were school avoidance kids, or who were depressed, or who were couch potatoes and only into video games? How do they get diagnosed with this? And then I said, why do only type A individuals get diagnosed with this condition? And as the words came out of my mouth, the answer was clear to me.
Yeah.
And that is because type A individuals very often have parents who are type A individuals who won't rest until they get the proper medical care.
Right.
And getting access to the few, the other issue about people with rare diseases is when a disease is this rare, that means the experts in this disease are really super rare. And they're not in every city, and they're not in every state. There might be 5 experts on the condition in the whole country.
Right.
And you do have to have the financial wherewithal as well as the physical wherewithal to travel. And especially when you have a disease where it's very difficult to travel. My friend who had the cancer of the appendix had to travel to NIH and from New Jersey, and she was dying of cancer.
Right.
And she had to go there every, 3 or 4 weeks. Finally, she and her husband, because they had financial means, they just rented an apartment near the NIH and got somebody else to take care of their children. And that's how they managed. So that, of course, brings up the issue that most of my guests have mentioned in our podcast, the issue of healthcare reform and universal access to healthcare.
Yeah. 1
minute on that topic. What do you want to say? Go.
I'm having this conversation right now with my son-in-law, because he's on Medicaid, because he's 29, or I think he's 29 still, but he's got the pancreatic cancer, the acinar cell carcinoma of the pancreas, and he's a big Bernie supporter. He's all about Medicare for all, and I'm more about choice. Mm-hmm. I like universal health care, but I like choice, because I have good insurance myself. So I'm just voting Democratic no matter what. And that's all I've got to say about it.
Yeah, I guess I wasn't asking for a specific voting recommendation, but thank you. Just sort of the bigger picture issue about how somebody who's 29 can get, severe life-threatening cancer and, have to get care somehow.
It's
And they fall through the cracks.
well, he's got Medicaid, so his doctors made sure, because he was on insurance when he had it, so he had to go on Medicaid. I mean, it is what it is. I mean, he's got a life-threatening disease, and he had to go on disability, and which he didn't want to go on. And he actually came off of it because he felt better. So as soon as he felt better, he went off of it instead of staying on. But I think our government's gonna pay for it either way.
Right.
So, let's be smart about it.
Right. And I think that's the other message to people who do love their health insurance. The thing I'm always pointing out to people, because you don't think about this when things are good, but you could lose your job. You could lose your marriage. You could get divorced. You could lose a leg. You could, anything.
And we could also lose the ability to get coverage for pre-existing, which was what it was like before. And that, for me, as someone who had a sick child, when I didn't have I actually got a job for insurance when I got divorced, because every time I went to the doctor, my ex-husband, some days he'd pay the insurance, some days he wouldn't. So I didn't know if she had insurance or not, but I knew that at that point, at her age, pre-existing wasn't covered. And there was a lot of, the medical bills were incredible for my daughter. And I'm so glad she's 30.
Yeah. Right. And, at this point, fortunately for many of us, we can keep our kids on our insurance till 26.
26, yeah.
But if you're divorced and their insurance is coming from the non-custodial parent, they're not required by law to keep them on their health insurance till after 18. So that's another very important point that a lot of people, need to understand. Anyway, I could talk to you all day. But we don't have that liberty, and other people are riveted in their cars and whatever, but they have to get to their next thing. So where do they find your show?
You could go to thebalancingact.com/rare is the website. We have a whole library of the Behind the Mystery series there. We're on weekday mornings between 7:30 and 8 on Lifetime Television. Also in syndication. We're in 500,000 hotel rooms. We're everywhere. So.
And you can DVR it.
You can.
Okay, and before I let you go, I ask every guest, what was their most unique, interesting, different, or memorable experience, aside from this interview, that you've ever had in a ladies' room?
I think, and this happens to me a lot, women will walk into the restroom, they will look at me, and they will pull up their shirt, and they will say, "Hey, I had a breast reduction, and do you want to see my scars?"
What is it about you that they're doing that?
I have no idea.
I have to admit, that's the first. I have not heard that one before.
Yes, it's happened to me many times, and it's quite a bizarre. I've seen more breasts than I care to see. So.
Well, I will say, just as Elizabeth Warren says she has a plan for that, I'm starting to say I have a podcast for that. And we actually did talked with Betsy Brent about tweaking the teens. And we talked about the incredible rise in plastics and cosmetic surgery in teenagers. And how do you handle it as a parent, advising your child about going through cosmetic surgery as a teenager, making the decisions, or women who are adults who had cosmetic surgeries when they were teenagers that now didn't go so well. But one of the most rapidly rising cosmetic surgeries in teenagers is breast reduction in boys.
Really?
Yes, because of obesity and, gynecomastia, which is otherwise known as man boobs.
Wow.
This is very embarrassing to them. So I was very surprised to find out that fact. But I'm much more surprised hearing how many women are showing you their scars from their breast reduction surgeries.
It's crazy. So that's my bathroom story.
So I learn something new every day. That's one of the things I love about doing this podcast, is not only the opportunity to talk to fabulous people, but also to learn so much new information. I want to remind everybody that next week is National Rare Diseases Day. So of course on Twitter, Facebook, Instagram, #National Rare Diseases or #Rare Disease. But of course, for people who are living with rare diseases or living with those who they love who have rare diseases, National Rare Disease Day is every day.
Yes.
One of the things that I always tell people about rare conditions is that when it affects you or somebody you love, the incidence is 100%.
Yes.
So, and of course, anybody who has questions for Carri or for me can send them to me at askdrdonica@gmail.com. And of course, you can find me way too often on Twitter, Facebook, Instagram at Dr. Donica. Thank you so much for joining me. It was such a pleasure. And I'm looking forward to the upcoming shows.
Thank you so much. Really appreciate it. Take care. Bye.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.